You're watching Studio Ken. Make sure you don't miss any episode of Studio Ken by subscribing to the YouTube channel. To subscribe, search for Studio Ken on YouTube, click subscribe on the bottom right of your screen, and set a reminder. You can also watch Studio Ken on Diamond TV on Wednesday at 18:30 and on Saturday at 19 hours. Studio Ken, the home of Kennedy Gondwe, on YouTube.
The exclusion of Zambia women's national team captain Barbara Banda from the African Cup of Nations on account of gender verification rules has raised more questions than it has provided answers. A player who featured at the Olympics and will more than likely play at the World Cup can't feature for her own country on her own continent. She has played in China and a few European clubs are after her signature. Yet she became a center of the controversial rules by the Confederation of African Football at the WAFCON. While medical issues are private and confidential, and we ought to respect that, the prevailing circumstances have raised the curiosity of many people. But our situation is not unique. In fact, two of our teammates, Rachel Kundananji and Rachel Nachula, also suffered the same fate. The difference, Kundananji and Nachula, unlike Barbara, did not travel for the tournament in Morocco. Today, we sit down with a medical expert to discuss the issue of gender verification in sport. He needs no further introduction. His name, Dr. Aaron Mujajati.
If you're looking for exclusive and exciting interviews, well, you've come to the right place. But do not forget to hit the subscribe button for you to subscribe to Studio Ken for those interesting insights and, of course, those one-on-ones and very, very exclusive content. So hit the like button, do the right thing, and subscribe as well.
Doc, welcome to Studio Ken.
Thank you. Thank you. It's been a while. Yeah, it's been a while since I was here.
Yeah.
But I see you're doing very well, actually.
Good to have you as always.
Yeah.
So, I'm sure you followed the issues surrounding Barbara Banda and her disqualification from the Women's African Cup of Nations. Before we go into the details of the gender verification form, scientifically speaking, how do you define a man and a female?
That's a very difficult question, and I'll tell you why it's difficult. Generally speaking, when it comes to gender or assigning a sex marker to people, we use the binary system. And the binary system is very much coded, first of all, in our traditions and cultures, in our religion, and even in our laws, that men are either male or female. Now, the difficulty comes when you observe in nature that actually there's what we call disorders of sexual development, where there are people who are born and you cannot tell whether they are male or female. These are either intersex people, especially people who are born intersex, or disorders of sexual development, if you like. So where do you place those? Okay, and if you're going to be fixated on the binary system, then you would then be faced with a problem where you have somebody who is born, for example, with external male genitalia, but internal female genitalia. There's a case in point of a person with external male genitalia, but has a uterus and is having periods. What do you do with someone like that? Okay, so to say how to determine someone's gender, if you are using the binary system, it's easy then, because we are either male or female. So they will check your genitals. Are they male genitals? But if you're going to look at an intersex person, you'll be lost if you're just going to use the genitals or the external appearance of the genitals, because in intersex people, they have a bit of this and a bit of the other. So what do you use? Do you use internal organs, internal sexual organs? There are people who have both ovaries and testicles internally. So where do you classify those? So in nature, really, there are some of our brothers and sisters whom nature has had them or has handed them this very complex developmental challenge that they face.
A challenge indeed, and just going by your definition and your explanation, it is confusing.
It is very confusing.
We are still fixated. One can either be male or female.
Yes.
And those that may have a bit of both actually face a lot of stigma.
A lot of stigma, a lot of rejection. And there are some cultures where people who are born intersex were actually thrown away in the bush. Or if a child is born and the midwife can't tell whether this child is male or female, and things are looking confusing physically, they'll just throw them in the bush to be eaten by dogs or whatever. Or they'll just throw them away and tell the mother the baby didn't survive. But with modern medicine and having gotten rid of those traditions, these intersex people live among us. Here in Zambia, name it, anywhere, they are there. Now, the challenge we faced as society is that we've buried our heads in the sand for a very long time. We have continued. I think it's mentally soothing to continue believing that people are just male and female and that's it. And there's nothing in between. And yet in nature, there are in-betweens, yeah? Both at genetic level, even at physical level, even at hormonal level, there are in-betweens. So those people that find themselves in between, for example, you've seen people who are born without legs, right? The society is fine with that. You've seen people who are born maybe without eyes or maybe with an abnormality, say, of the skin or something. But we forget that when a human being is developing in nature, during a process called organogenesis, any organ is not exempted from an abnormal development. All our organs are not exempted from that, except that we become a bit touchy when the abnormality is happening with our genitals. Why? Because we've attached who we are, whether male or female, to our genitals. Now, is our genitals the core or the be and end all that defines whether you're a man or a woman? If that is the case, then we have a problem with people who are born intersex, because if you look at them physically, they have both.
So, you being a doctor, if you've got a situation where someone is born as an intersex, what do you put on the form that identifies that person?
That's a very difficult question, but pertinent. And it is that question that society needs to answer. What should we be writing on the form? Should we say this child is male? Because they are clearly not male. Should we say this child is female? Because they are clearly not female. Because they have a mixture of features that don't categorize them clearly as male or female. So what do you write on the form? What do you tell the mother or the parents? That your child is what? Is a boy? Or your child is a girl? Is that what you tell them? So it's a bit of a challenge at that point. And that is why policy needs to be reviewed. We need to have an honest look at how we deal with these members of our society. And the unfortunate thing that intersex children face, or parents who are raising an intersex child, or even an intersex person themselves, the biggest challenge they face is that they are very easily confused with transgender. They are very easily confused with homosexuality or gayism. They are very easily confused with lesbianism. They are very easily confused with that. Now, these are people who are clearly born with, for lack of a better term, with a disorder of sexual development. So what do you write on the form? That it's a boy? Because it's clearly not a boy.
Have you been faced with such situations?
Yes, I have.
And what have you written on the forms? Extremely
Extremely difficult. So we've ended up writing either male or female. That's what most health practitioners do at present moment. You know why? Because the law does not give you any other option. Remember that the binary system for gender is encoded in our law. So the law does not allow any practitioner to say anything else other than male or female. So you are fixed. And yet you know that in nature it's not that fixed. So we write male. And we talk to the mothers, counsel the mother, and you write male, knowing fully well that this child has also features that are consistent with female and male at the same time. So it's a hodgepodge of things. It's a mix of things. Yeah.
But isn't that unethical? I mean, as a doctor, that is tantamount to not telling the truth. In as much as the law defines
the ethics. You see, this is where the biggest age-old argument comes up between ethics and the law. That's why you find that doctors in some jurisdictions have been arrested. You know why? Because our ethics supersede any other code. Sometimes you find that, say a government wants me to kill you, and they've brought you to me. that no, we want to kill this one, and I say no. You understand? I'd say no because my ethics don't allow me to do that. There's been several issues where you find that the law permits, but the ethics don't, and doctors have gone to jail for that. Now, so when ethics come in conflict with the law, which happens quite often, as doctors we are bound to follow our ethics, because our ethics put the rights of the person who is in front of me front and center. It's about this particular person. It's not about the law, it's about the person. So if you ask me, is that unethical? Very difficult to say, but strictly speaking, in the purest sense of the word, you could argue that it may be ethical, it may be unethical, but where is the abrogation of the ethics? Is it by the practitioner or is it by the law? So if you put the practitioner in a position where the law is putting them in a corner, it makes life very difficult. And this is where now, as a practitioner, you now begin to say, what's my best way out of this is to, first of all, counsel the parents. Be very truthful with the parents. You tell the parents the whole truth. To say, first of all, this is a normal child. Because again, you also don't want to start using terms that dehumanize the baby. Because if you start dehumanizing the baby when you're talking to the parents, you create a disconnect. Because the mother now or the parent will start thinking, what's going on here? You've had mothers who've been divorced or chased from their homes by their husbands because they've brought home a baby who is intersex. You've had babies abandoned because they're intersex. And that is why once the rejection starts at that level, that is where we need a strong policy in Zambia that clearly guides medical practitioners, which at present moment we don't have. How do you handle a child who's just been born? That's why your question is extremely difficult, because it raises far-reaching questions that at present moment have not been answered.
You've had sight of the contentious form from the Confederation of African Football. And I must say, in the case of Barbara, like any other person, she's entitled to her privacy. She's entitled to her own confidentiality. But that form, according to what you said before we started the interview, is vague.
It is vague. If you sent me that form from CAF as a medical practitioner to say, here's a form that CAF wants to do sexual or sex or gender verification, and they send a form that is so vague, that form is very, very vague. You see, if you are going to ask a practitioner to say, can you do gender verification in this person, you understand, you have to also give us your criteria. What is the criteria that has been adopted for gender verification? Now, international sport has had a lot of debate with regards to gender verification. This issue of gender verification has been a controversial topic for a very long time. A very, very long time. And remember, there was a time when they would do like on-the-spot physical examinations with gynecologists, stripping women and examining them physically to check whether they have, what type of genitalia they have. They abandoned that because there was an outcry, because it was dehumanizing the person. And the other challenge you have with gender verification also has to do with the fact that why do you just do it for females? Have you ever seen gender verification in male sports? So, now if you give me that form, and you are not very clear on what tests you want us to do, because that form doesn't say what tests you should do. It just says do gender verification. So how are you going? Unless there's more information that comes with that form that you didn't give me.
But look, clearly, the one thing that is very, very clear is that Barbara has played at the Olympics. Most likely, she's going to the World Cup. Olympics, FIFA endorsed. World Cup, FIFA organized. In her own continent, she can play.
CAF found themselves with a challenge. I had a chance to look at the issues. The International Olympics Committee and the IAAF, these guys have undergone a lot of changes in the way they consider gender verification. They used to do physical examinations, they abandoned that. They've now gone to just testing for testosterone. So they check for the male hormone in you. If the male hormone is above a certain threshold, they'll say you can't participate. Meaning that by implication they are saying that if your testosterone, which is the male hormone, you are a female, if your testosterone levels are at this level, then you are no longer female. Meaning that you are no longer fit to participate with females. Now, that raises serious questions. Very, very serious questions that I think the sports governing bodies need to seriously reflect on. And as they reflect, they also need to engage medical governing bodies like the World Medical Association, for example. Engage the World Medical Association, because the way the sports, if I'm going to take the sports community or the sports governing bodies in the way they interpret the results and the implications of the interpretation, it raises very serious questions. Questions that are at variance with the way the medical fraternity would use, or the criteria the medical fraternity would use to arrive at assigning gender to someone.
But Doc, these sports bodies we're talking about are full of medical doctors.
Yes, they
the
are.
likes of yourself.
Yes, of course. But the issue is this, that remember that that criteria was not born out of a medical governing community or a medical community. If the criteria was born from the medical community, I would say, okay, fine. We processed it as a scientist, so I also accept it. Now, I have a challenge with that, and several other people out there would have the same challenge, if you really reflect on it. My challenge with just using testosterone to determine whether someone can participate as a female in a sport, you are implying that if your testosterone is at a certain level, you are not a female. By implication, that's what you're saying. Now, the challenge you have with that is that just because the testosterone is high does not mean that that testosterone is sensitive as well. In the medical fraternity, we don't just look at testosterone alone to determine whether you are male or female. And I'll tell you why. There are other issues that can cause higher testosterone in women. For example, a woman who has polycystic ovarian syndrome.
What's that?
This is a disease of the ovaries, simply put, in a woman. And they will have high testosterone. And they present with either pimples on the face, facial hair, very small breasts, and things like that, with bit muscular bodies. But the problem there is not that the person is male or that the person is not female. Okay, here's the issue. Their test does not say you're female, you're male. It says you're not female enough to participate in this. Yeah. So are you saying to us that a person who walks into my office and has polycystic ovarian syndrome is not female? Or an athlete who is playing soccer who also happens to have polycystic ovarian syndrome is not female enough to participate in sport? Is that what you're saying? Now, there are other conditions that happen to women that can also increase testosterone. There are plenty. Some are pathological, some are non-pathological. So really, to rely just on one test, from what I have observed so far, if I'm wrong, they can correct me. But from what I've observed so far, from CAF, from the IOC, from the IAF, they are all just testing testosterone alone. Now, there's a problem there when you do that.
Okay.
It's a big problem. And it needs to be relooked at, because you can't say somebody is not female enough to participate in sport because of high testosterone. The other reason is this, is that there's no real evidence that proves that somebody with high testosterone is linked to higher wins in terms of medals, or that higher testosterone is linked to an undue advantage in any type of sport.
That's a belief, because...
But there's no objective evidence. Show me proof that you did an objective study, okay, with data that clearly shows that if you have high testosterone, you will perform, or you will, for example, if I'm running with you in a sport, or I'm playing a sport with you, show us, or show the world, evidence that shows that women with higher testosterone had a higher medal winning streak. And that it's so obvious that if a female has higher testosterone, therefore, it's a must. That's why I said that it's very important for sports bodies to engage the medical community, either through the World Medical Association. They need to sit and study this issue properly, so that when we're now applying these rules to people, we all know that, okay, fine, this is the basis for this. The other issue is this: just because you have high testosterone, it does not mean that it is sensitive, because that testosterone needs to be sensitive. So now, how do you measure testosterone sensitivity in someone? There's no objective way of measuring that.
I guess the thinking there is that the people that have got high male organs or testosterone, it's always a tongue twister with me, is that have got a competitive advantage, because it is assumed that they are males just clothed up in a female body. So it's like me competing with your daughter.
Now, here's the thing. That's a serious assumption that you're making.
Yeah.
Because there's no objective evidence that proves that that is the case. We just discussed intersex people here, okay? Here's a child who's being raised intersex, and can they participate in sports at school?
Yes.
As what?
They're human beings.
No, they'll participate as what? As male or female?
I guess that's what we are trying to unpack here.
That's the issue.
Yeah.
You see?
Yeah.
So here's somebody who's been raised intersex, and the parents, because of the law which forces them to choose one gender, and they cannot even say someone is in the middle, and the parents decided, okay, we're going to raise this child as female. And this child is intersex because of the disorder of sexual development. If you look at their genitals, they are intersex. And they're being raised as a child, as a girl. So they cannot participate in female sport? Is that what you're saying?
No.
And if they can't participate in female sport, can they participate in male sport?
Yeah. So where do you put them then?
That's the issue. So now we are now systematically discriminating against a group of people through no choice of theirs, who were born in the middle. And which raises the question, should we reconsider the binary system when it comes to assigning sex markers? Because here's the thing. Here we are discussing sport. Which toilet should an intersex person use? There's an intersex person I know here in Zambia. When they walk up to you, they have a full beard, and they look like a man. If they walk into the toilet, they cannot stand at the urinal. They'll have to go and sit on the toilet pan, because they can't urinate standing.
Because they've got female
Because,
organs.
yeah. Now, if they walk into the female toilet, everyone will be so scared that what is a man doing here? So what do such people do? And society, unfortunately, and this problem is not just at the sports governing level issue. It's also at our level as a community, as a people. We have assumed too much that human beings are just male and female, and that's it. And that's why we struggle to deal with people who are born in the middle. And the struggle is not just here in Zambia. As you can see in the sports community, the struggle is international, apparently.
And talking about that, it confuses me to see that CAF have got their own rules. FIFA have got their own rules. This player who can play at the World Cup and the Olympics cannot play here in Africa.
You see, there's this interesting case by Caster Semenya,
Yes.
where she's contesting, and I think she should contest. She's contesting the way she was banned and the whole thing. And their argument, if you look at it, this is a very difficult issue. And what makes it difficult is our mentality, because in our heads, we have always assumed that people are just male and female. And we want everyone to fit in these two categories and proceed in life that way. And that's where the problem lies. Now, because she has contested in court, part of the reason is that a lot of big governing bodies in sports have chosen not to push so much the issue of gender verification, because they are waiting for the court to determine. Yeah.
Now, is it fair then to subject these people to medication to bring the testosterone levels down?
On what basis?
That's what we've read.
That's what I said earlier. That's what I said earlier. If you're going to say that because your testosterone is high, can you drop it? what objective evidence do you have that shows, that proves that higher testosterone is linked to higher winnings of medals? Has anyone done a systemic study? Okay, I have not seen one yet, and I'm prepared to be corrected. I am very open to be corrected. So if somebody has done that study, let them share it, we have a look at it, and see.
Yeah.
Without that evidence, you are just discriminating against people.
I've personally experienced a situation where the women's team, Zambia women's team, were playing, I think, Zimbabwe. And there was a demand from the Zimbabweans at the time that they were not sure about the gender of one of the players. And they wanted that player stripped naked in order to verify.
But you see, governing bodies used to do that. Like on the spot, they would take the player
unfair.
in a room.
It's dehumanizing.
And they'll get a gynecologist or a doctor to examine and do all manner of physical examinations on the person. And that has been voted against. It is no longer done, but remember that it was being done. Yeah. It was barbaric, to say the least, because you are really embarrassing the person. You are treating the person like an object. You forget that this is a human being with feelings, and you're embarrassing them. Yeah. So that's why sports bodies stopped doing that. Yeah. So the complexities of gender development are so complex that I think as humanity, we are not yet at a point where we have fully grasped the complexities, because it's a very complex subject and a very difficult one. Yes.
What we saw is when the form was sent to FAS,
Yes.
FAS kept quiet, or maybe they were engaging CAF quietly in the background. But it took the CAF president to say, we don't have any evidence of this, for then FAS to start running around here. If you were in the position of FAS and you received that form, what would you have done?
I would have asked for more information. Because that form, if that's all that FAS received, then they needed more information. I've looked at the form, I've read the form. My reaction to it is that it needed further particulars. That form does not give enough guidance to anybody who is, say for example, you bring this person to my clinic or to anybody, to any doctor's clinic or to any doctor, and all you have is that form. No. Because you are assuming that gender verification, the way us in the scientific community perceive gender verification is the same way that you people in the sports community perceive gender verification. From what I have observed so far, clearly there's a big difference. To them, gender verification is testosterone, and that's it. But to us in the medical fraternity, that's not even the beginning of the argument. We look at more factors than that, because we know that gender, from the perspective of pathology, is a very complex issue. And also, we also understand that testosterone alone has several limitations, like I've demonstrated to you. That if you just measure testosterone in someone and it's high, and you say, I know you can't participate in female sports, what if that person has polycystic ovarian syndrome?
And we've seen in developed...
and then also, you have no proof to say that there's no objective way of measuring. You see, just because a hormone is high in someone, it doesn't mean it is having biological effect on that animal. Okay? For you to prove that that particular hormone, as high as it is having biological effects on that animal, you have to measure the sensitivity of that hormone in that particular situation, and you also have to measure its activity. Now, right now at present moment, I'm open to be guided, and I'm open to receive alternative facts that demonstrate that there's an objective way of measuring testosterone sensitivity. Now, if you want to use testosterone for gender verification, and in fact, don't even call it gender verification, as a criteria to qualify to participate in female sport, and you want to use testosterone, some of the things you would want, some of the information you would want, and I'm hoping, I wished there was, is number one, that you have evidence that shows that higher testosterone is linked to people winning easily and an unfair advantage, and that's number one. Number two, that you have a way of verifying the sensitivity. Just because a hormone is high, it does not mean that it's sensitive, that it's actually having an effect. Some of the reasons hormones may be high is because the feedback mechanism to stop it from production has stopped, or the receptors on which the hormone is supposed to act are blunt, and therefore the body is sensing that, no, we're not getting good results here. Can we produce more? So the body begins to produce more of that hormone.
We've seen, yeah.
So really, if you don't have some of that criteria set properly, you will continue having problems, and this testosterone criteria that we're using will continue having challenges, because it will continue being challenged, especially from the medical fraternity, because what the sports governing bodies are doing is confusing us as well.
Doc, we've seen in developed countries where someone may be born a man, everything about them is a man. Then they grow up in the adulthood. They decide to change their gender. They go for a procedure, and before realize it, they're developing hips. Where do you classify such people?
No, transgenderism is very different from intersex or from ambiguous genitalia, as we used to call it in the medical fraternity previously. So transgenderism is where somebody is born clearly male or clearly female. Even when you check their birth records, there was no confusion as to whether somebody was male or female. And then later on, they decide to change their gender by any persuasion. I don't want to go into the reasons or their persuasion. I'm explaining to just show you the difference. And then they go and have their sex change, do the surgeries and all that. Now that's transgenderism. Intersex or ambiguous genitalia is very different in that this is somebody who's born with sexual characteristics, both internal and external, that are neither clearly male and they are also not clearly female. So that's the difference. So a transgender person, and also it raises also questions. Can a transgender person participate in female sport? That's a difficult one. Difficult in the sense that I would say no. A transgender person should not participate in female sport.
Yeah.
Because by any biological criteria you're going to use, if you're going to measure anything on them, you will find that, biologically they're actually, male.
Male, yeah.
Yeah. But for a transgender, for an intersex person, you will struggle to classify them either as male or female.
What do people like Barbara need at this very difficult time that I'm assuming she's going through?
You see, with Barbara, I have a bit of a challenge in the sense that I don't have her details are not as in public space as Caster Semenya.
Yes.
As Caster Semenya's case is there's so much in public space about her case. So Caster's case is easier to discuss. Barbara's case is extremely difficult to discuss because I don't have the details.
Yeah, of who
matter.
she is, what the issues are.
What's the issue?
Only basing it on the gender verification.
And also I'm basing everything I'm saying based on media reports. Now, it makes it extremely difficult for me professionally to delve deeply into Barbara's case specifically, purely based on what I've read or heard in the media, because I don't have any objective information on what's going on with her. My assumption, and I'm basing my assumption purely based on what is currently obtaining in the sports fraternity, is that in the sports fraternity they are now saying that if somebody's testosterone is above the lower limit of men, or is touching the lower limit of men, then they should not participate in female sports. Okay, so the gender verification, I think the threshold is now around 5 nanomoles per liter of testosterone. So if the testosterone is above that, then they'll say, no, you will not participate. So purely based on that, then I would then extrapolate and say, that is most likely what they found with Barbara. Now, as to why that is the case specifically with her, I don't know. Because I don't have her details, I don't have her medical records, so I would end up, I can't go beyond what is
you end up speculating even further.
I can't go beyond what the CAF and the IOC want to see for gender verification. I can't go beyond that. Okay. So basically, it's a case of where they most likely found that the testosterone levels in her were above 5 nanomoles, and they determined that she cannot participate in a female sport. Now, which I argue, and which I think that several other colleagues would argue, is not a very scientific way of addressing the issue.
Doc, you've also studied law. And speaking to the issue as a person who studied law, what should Zambia be doing to address such issues or such a conundrum?
Well, I think that we need to start raising questions that are, first of all, scientifically based, first of all. I think we need to challenge the sports governing bodies to give us more evidence. Challenge them to give us more particulars as to how did you arrive at this? What body of evidence did you rely on to choose testosterone? Okay? And if we take the testosterone criteria and we weigh it against other factors that I talked about, would it still stand? And if it stands, then well and good, let's continue using testosterone. We are not saying the process is flawed or whatever, but we are saying that is it rational? And as Zambia, Zambia as and any other sports governing body, they need to start raising these questions with their sports governing body. To the bigger global sports governing bodies, my advice is that apply a bit more science to what you're doing before you arrive at a decision. I know you probably have doctors among yourselves, you have scientists among yourselves, but come out with more rational and more evidence-based policy, because this can easily be challenged. This testosterone criteria can be challenged, and it doesn't stand very well when you subject it to strict scrutiny. It doesn't stand very well.
Doc, as usual, thank you very much. Just chatting with you is
You're
always,
welcome.
always.
But this is a very difficult subject.
I know. But we needed to have
it. It's not a very simple one, and it will continue to be controversial. This gender verification exercise will continue to be very controversial. It has been controversial for years, and this is probably not the end of it, in my view.
Thank you.
You're welcome.
If you're looking for exclusive and exciting interviews, well, you've come to the right place. But do not forget to hit the subscribe button for you to subscribe to Studio Ken for those interesting insights and, of course, those one-on-ones and very, very exclusive content. So hit the like button, do the right thing, and subscribe as well.